Can I have approval of the minutes from December, please?
So moved.
All those in favor?
Uh,
All right, we'll get started with our old business, from the clinic.
So, old business. Started with a couple of cities. We had the RSV vaccine. We had used up our Big Fortis, which had 2 separate doses depending on the weight of the child. Now we have Infantia, which is 1 dose for all weights. So that's nice and easy. Not hearing whooping cough out there as much from the Amish community, but they're still coming in for the DKP and the Tdap for some of the pregnant women. And with our PEP grant, we did meet all of our deliverables, we've met all the requirements, and that's about all we've done with that so far.
School health liaison projects.
Currently, we just finished up doing the 300 invalid drinking cups for the Amish schoolhouses, so that covered 8 schoolhouses. Kind of lower the respiratory illnesses that are out there. We continue to do lunch shaming with the county schools. We did 750 toothbrush kits to the county schools, as well as partnering with the hospital to get out naloxone doses during their CPR classes. And then we just continue to work with community partners. That's it for me.
Sounds good. How about environmental? We'll go through the food policy update approval that was in your packet, if you had a chance to look at that at all. Any questions or comments?
There's any questions or anything about that? I mean, it's pretty much just the same as what we signed back in 2023. It's just different verbiage to go hand in hand with the new violations. So it's no longer critical, non-critical. It's now priority foundation and core. So we kind of just had to make those adjustments to kind of go with the new food code that rolled out this beginning of this year, so.
yeah, I'll add that this, same as when we did this back in 2023, I mean, these are all things that we already have the authority to do under the existing ordinance. We just felt a few years ago when we did this, that it would be better for us to have some written clarification, both internally and externally, on how are we gonna handle it. And as Taylor mentioned, it just updated food there includes some different categorization of things that was not in there before, so we just had to fix again. It's all stuff that we have the authority to do anyway. Nice written policy that we can follow and make sure that we are being consistent and clear with how we're handling enforcement issues.
Does anybody have any questions or comments on policy? Can I get a motion to approve?
I so move.
So,
All those in favor? And then the next agenda item has health department door.
I just kind of left that on there, just know where we were standing with that, so.
Yeah, I had just talked to Barry a little bit before the meeting about that, because I was unable to be here. Evidently, from what I understand, someone had talked, maybe you did, Barry, did you touch base with Steve Bailey? Well, anyhow, at this point in time, the status is, since it's rather, not 100%, but we're probably gonna use this building and renovate for the court and probation, community, et cetera, et cetera. And I think we decided we're gonna hold off on that because there's gonna be some remodeling throughout the building and address that at that point in time.
All right. Anything else anyone have for old business?
I don't think so.
Okay. All right, we'll just keep trucking right along through.
for you to sign.
Oh, perfect. Okay. New business. For clinic.
First off, we have some staff changes that you're all aware of. Holly is not with us right now. I'm the health nurse right now, the only health nurse. So we've been working very, very hard to maintain all of our required responsibilities for state policy. Just to keep up with what we can right now. We have, at this time, put a pause on our remote clinics. So to Geneva and the Unveiling Love clinics, we have paused those through March. Last I knew from Kristen, who helps us schedule, we have rescheduled everybody that was on for March to come into our clinic for vaccines. And we have already gotten a lot of phone calls from our Geneva people to come in as well from February. So we're hoping to restart that as soon as we have enough hands. Since again, I'm the only nurse. So that's where we're sitting on that for our clinics. We are still giving out a lot of vaccines. I'm getting reports from the Amish community, no lab confirmed, but they are reporting chickenpox out there. So they're coming in asking for the chickenpox vaccine. A lot of them are asking for their children who are under a year old. We cannot administer the chickenpox vaccine under a year old. So I educate them on what to do to keep eyes on the kids, keep them away from people who are sick with chickenpox or suspected, as well as shingles. Children can get chickenpox from shingles as well. So we've been educating them as soon as they can, they come in for the chickenpox vaccines. So that's what we're sitting on that. We have had a case recently of Haemophilus influenza, so I'm trying to encourage that vaccine as well. That one's usually in our combination with our DTaP. A lot of people are getting that one. Other news, we do have home tests for radon and syphilis testing that anybody in the community can come in, take home, perform. They can send it off. There's information on that as well. That's not everything. Oh, no. Also, with the community health clinic, it is a clinic out of Shipshewana. They were requesting that we purchase a hearing screener to screen newborn infants for loss of hearing just for this county. And we are very, very close to getting an MOU signed and getting that machine purchased for this community. I believe that's all my updates.
I'm gonna just jump in, not on the medical stuff at the end there, but I'm not sure that all of you are aware of the staff changes that have happened. I just think some of you might be aware of some of them, but not everybody, all of them. So, on the environmental side, Jessica was on maternity leave, towards the end of the year. That maternity leave was scheduled to end in January. Sometime in, I think, mid-December, she submitted a resignation effective the first of the year, her position. So I think we're in the process of scheduling and that job has been posted. We're gonna have some interviews scheduled, getting all that taken care of. And then shortly after the first of the year, Holly resigned on the clinic side. So that is where our shortage comes on staff right now. It's a little smaller crew than we used to see for these meetings. So just wanted to make sure that update was out there for those who weren't aware of those things, because they have kind of, bang bang here since the last meeting. So appreciate it.
May I ask a question on vaccinations?
Yes, sir.
I've kind of lost track of all of the vaccination requirements, et cetera, et cetera.
Yes.
My question is, and I probably should know this, but I don't. Are our public schools still requiring vaccination before enrollment? Okay, what about the private schools such as St. Joe, Lutheran schools, and Three Oaks?
That I am not sure of at this moment. I will get you that answer.
I can get you that answer.
Yeah, she does at the school.
So I work with the schools on immunizations. So they're not required to have every single ACIP guideline met, just like the public schools, because they don't receive funding. But it's at their will of what they want to do. So they're not run on they don't fall into our numbers or anything when it comes into checking that vaccine rate.
So we're not sure if all the children are vaccinated or not.
But we do run through the public or the private schools because we've asked for their permission. So we go through and anyone that's behind between Kristen and I, we send them a list and give them the opportunity to know they're behind and where they can go to get it and how to find the resource.
Okay,
So it's not that we just let them run wild.
right,
We give them the opportunity
right.
if they want it.
Do they report back to you?
Yeah, they do. They work really well with us. I mean, all of them.
But, and as far as homeschool is concerned, who knows?
We don't really know, and that's the thing, and that we had a meeting about that with the state as well. And that's just something they can't gather numbers on because there's multiple online school systems now. So we have no idea. Now they have coverage groups. So we joined in on like these community partners to where we can hit homeschool kids with the information. But as far as vaccinating them, that's at their will, right?
And likewise for Amish schools.
You got it. Mhm.
Yeah, so, you know, I have no
Yeah.
control over any of it, but it's kind of concerning to me. But-
It is. I mean, and we push a lot of information out. I mean, we attend a lot of community groups too, to be able to say, hey, this is what you need, this is where you go. Just like today, we'll be doing one. And that's gonna cover all the immunizations and it's gonna give a list and kind of put it in fifth grade reading level. Because that's the community I'm hitting today is Amish. No, it's just the way it is.
Okay, thank you.
Do you feel that there's an 80 percentile, 90 percentile in the like the Catholic and the Lutheran schools?
I'd say they're
Are they
going up,
pretty-
actually.
I mean, for my kids go to Lutheran school, and I know for the one they go to, the majority are vaccinated. And
I know
they're
it's a-
not- Yeah.
At
they
St.
are.
Peter's the same way. They
Yes,
pretty
it
much
is.
require.
Yeah, but they just give the parents that leeway to say whether they want to. It's not saying you can't attend here if you don't have.
And it's the same with public schools. There are some kids in the public schools that have like exemptions. So they write a religious exemption or whatever, and they submit that to the school, and that gives them the leeway to not have to be vaccinated in public school. So it's everywhere.
Just education, that's all we can give them. Education and knowledge on what it can do to protect them, what to prevent it, and what's coming.
And
Because
with
they're gonna
public,
come down with something and come to somebody.
yeah,
Die
and with
with us.
public
Yeah.
schools, we have two exemptions. Your medical exemption that a physician has to sign saying medically they should not get this because they've had a reaction before or whatever. And then we do have the religious exemption. We don't have a personal exemption, so a lot of people say it's my religion now. So, and our exemptions have went up
Yeah, I was gonna
in
say,
public schools.
Yeah, I'm sorry, you're what?
Our exemptions have went up
Okay.
since COVID.
So, maybe I'm not allowed to ask this question, but, do you feel like, the Amish population are doing quite a bit or no idea?
feel like they are. I mean, they've been coming to a lot of the events we've been having. They've been taking the knowledge. And if you look back even on our shots, I believe there's numbers in that book. I mean, just from even 3 years back to even when it just started actually marketing is what I'm gonna consider it out there to the Amish community. The shots have went up.
Good.
Immunizations really went up. But, you know, if they sit there and not know, we just gotta drag them in, get them the information. And, you know, once they get it, they're fine.
Yeah.
You know, because then they're gonna tell their community and they're gonna say, look, my kid's still living. They're so on these beliefs that aren't real that once we get them in, then we can get them in. You know what I mean?
Yeah, well, from the commissioner's view, we certainly appreciate the board's involvement and your educational efforts. We appreciate that very much.
I do have numbers. I did not make copies of this, but I do have numbers of the vaccines, patients we've seen over the last 3 years. We have 2023, 2024, 2025, and we printed this yesterday for all of January for all the patients we've seen and the vaccines we've given. What I give that to?
Go ahead and give it to Doug.
Pass around.
The numbers have been increasing year over year.
Oh.
We've already completed,
I'll get these back to you before we leave.
oh yes, sir.
I do actually
actually have more papers as well that have numbers on them. It has a lot more information as well of the clinic. Because in 3 months, I've learned a lot and what we're trying to focus on with those staff changes. I did print enough for everybody if you would all like one. I do have numbers on there. I also have the community partners on there. My pleasure.
Anyone have any more questions about clinic things?
On your new business, I was reading through the minutes on the new business part, and there was an incident where someone came in and was very disrespectful, et cetera, et cetera, et cetera. Okay, don't hesitate to push that panic button.
Yeah, that's what we,
That was on
that was Stacy last time and she knows, we told her.
Okay, if it's even marginal, hit it.
Right.
Okay,
We emphasized that at the last
Yeah.
meeting.
oh, okay.
That definitely needs to be hit.
Thank you, Megan, for that information. We'll move on to school health liaisons, upcoming projects.
So upcoming projects, so we're working on a grant for Bike Safety Week coming up, and it'll be able to cover all of the students within the county area for bike helmets at little of no cost at all to any of the school systems. I'm waiting to hear back some things with Donna as well. Then I will also be going on maternity leave, so I've kind of put a lot of my stuff on the halt as far as community outreach, but I will be doing one today, and then I have some scheduled out all the way until April, which Megan will attend if hopefully she can. Just because it's very important. It's important to be out in the community, regardless. So today we'll be hitting prenatal vitamins really for moms to make healthy babies. That's gonna be our big one, and thermometers to help prevent, sickness or them treating their own kids and resulting in a death. Then we also we'll do part of like the Safe Carnival, which is April 18th. And then we'll be hopefully partnering with the community health clinic and be giving vaccinations there along with the hearing screening, just because they already had an Amish-based population down there in Bern at the senior center. So the hearing screener will only cover Adams County residents only. It will not just be taken back to their place in Shipshewana. It'll be mainly for ours because our Amish are skipping that hearing screening because they have so many home births. It's just easy for them to refuse it. So we're just trying to capture that. That's kind of the other main reason for that hearing screener.
Is that gonna be very labor intense
No.
for you
no,
guys? No, pretty
No,
easy.
no, we don't have to do anything. We just kind of show up. Really, that's what we need to do, just show up, see what they're doing, see, get their clients for us to pretty much make sure that they know their requirements when doing a home birth too, that, we don't want to push for refusals of that hearing screen because that child's living with that the rest of their life. So just more education for them. That's about that. And it'll be in Bern area, so. That's it for me.
Environmental?
Okay, so obviously Luke spoke about some of the changes in our office. Stacy's also out right now and, we have no clue when she'll be back yet, obviously. And then Teresa's leaving on Thursday. So that's gonna leave me in the office by myself until the 17th. So over this last month, I've kind of just been learning a little bit of all three of the positions so we can kind of stay afloat while everybody's out. And so they put me into the drive program so I can approve deaths and I can do birth certificates and death certificates now. I taught myself how to do the quietus and the deposit money. So we got that taken care of. I can get that pretty good now too. Pretty much learning, you know, a little bit of all three of the positions so we can just kind of stay afloat while everybody's gone for the next several weeks or months. So
I know in the past when I was working here, down at the auditor's office, I believe they got a couple girls that
yeah.
would just share. Is anyone?
Shannon and I have talked about that, like if I wanted somebody to come up and help me answer the phones and
Yeah,
different things like that. And I think I'll be okay, especially with, you know, Chris and Megan will be on the other side if I need anything, but the big thing was learning how to do those births and deaths and, you know, approve those when they come in on drive and stuff like that. So if the crematory needs them right away or something else like that, that wasn't just sitting on hold for over a whole week. So
you're just gonna need help. I know you can do it
I got
yourself,
it
but
pretty down, but
you
yeah,
gotta go to
Shannon
the
and I,
bathroom. I mean, you
we're
gotta leave the
talking- yeah.
office. You gotta.
Yep, Shannon and I are talking about that right now.
There's-
Barry, you may not even be aware of this, but your son Nathan,
Yeah,
who is director of rural sewer district, he came in and talked to me privately about his availability to help out. I think he's quite knowledgeable, especially if there's some coordination that needs done between environmental and planning office.
Right, yeah, and we've had Joe Riccosi's been there from our state. He's been there on Fridays and helping us get through whatever plans we have to have and different things like that. And now I can issue septic permits after he approves them, so I did learn that portion of it too. So we're not completely sitting on hold or anything with anything. I guess if I just don't know something, they're gonna have to wait till I can get an answer, you know, so I don't. It's just gonna be kind of touchy go for a minute, but yeah. But Shannon and I are coordinating and if, you know, to get some help if we need to answer the phones and stuff, so.
Good.
I don't know if you had any other questions? about
well, since everything's on stop, what about the Burton apartment building?
So, okay, I did write notes about that because I figured you'd ask me. So Shannon Smitley and Mark Quinn and I, all did a significant walkthrough of the Swiss Meadows, facilities, all the buildings. And kind of just made notes about what we saw, what was concerning to us and things like that. Obviously they're in the middle of a sell right now. So we didn't want to bombard them. Luke can kind of touch on this too if he wants. We didn't want to kind of overwhelm them with too many things that we saw because I think we all want this sell to go through. So, Luke has been in contact with their lawyers and we lifted our unfit for habitation, off that, but one of the buildings did still have cockroaches in it, so we didn't want to completely lift all of the abatement off of them and kind of just give them whatever, because we still had some issues that, you know, we don't want to let just go out of sight or out of mind, you know. So we are going to be reissuing them another abatement because of the cockroaches and other littler things, but we just didn't want, again, anything to be too major to where their sale didn't go through or anything like that in the next month, so.
Is it pending, sale pending?
It is.
Okay. Our enforcement power on this kind of has two sides of it. One is that we can order all the residents to vacate. And the other side is we can order premises to be cleaned up to whatever standards needs to be done. So we had initially put in an order that said it is cleaned up by whatever date. I think it was initially January 1st.
Yeah.
Extension. otherwise, everybody's gotta get out. They did make some pretty significant efforts throughout.
Oh, yeah,
the
they
fall and
repaired a
early
lot
part
of
the
the
winter
stuff.
To try to get stuff taken care of. I know they had exterminators out, they had electricians out, I mean, they did a lot of work to try to get it up to speed. It's not there yet, but we did feel like it was appropriate to at least lift the notice to vacate, allow the residents to still live there while the remaining items get cleaned up.
Yeah.
We are keeping our order to abate in place, so they're still gonna be required to clean that stuff up. And I need to get back with them with some more specifics now that I've seen notes from the inspection that was done, but, they're working on it. It's a big ask. I mean, there's a lot going on at that building or those buildings.
Yeah.
But they're working on it, and then we feel pretty optimistic that with the sale that's going on, I know Tara did a little bit of looking into the new owners and some other properties I think that they manage, and they seem to be a good company with a good reputation that, will keep up with things once we get things where they need to be initially.
May I chip in and give the board an update on another area that's been a concern for not only years, probably decades, Country Acres. As of yesterday, and Luke, you can get the details from Clayton, if you want, but as of yesterday, there's been significant progress made on the legalities of getting something done out there. According to Nate, as well as Clayton, there's only one resident out there, and that resident seems to have their own septic system.
Yeah.
So the rest of it is not going in anywhere. So I was super happy to hear that there's been some significant progress made very recently on that. And like I said, Luke, if you want details, you have to contact Layton.
Yeah, we were overseeing all the capping and everything like that.
Okay.
2 summers ago to make sure that, it wasn't getting discharged anywhere. And
Okay, good.
I even went out and retested the ditch and stuff like that, so.
Has there been any soil testing or for people applying to build homes here lately? I mean,
Yeah.
you have to go do that too, or you have?
We have Greg's been really wonderful
Is it?
going
Okay.
out. Yeah, he's out of the office to speak to. It's just been one wheel off the bus going down the road. So, but we're fine. But no, yeah, he's been wonderful going out to the inspections and being there with the scientists and everything like that.
That's good.
Taking notes of, and files and stuff like that.
All right, I don't have anything else on the agenda. Does anybody have any other business to discuss?
I have a couple questions.
Sure.
Listening to. All right, saw in the paper where Bluffton has problems with lead. And my wife had some questions for me that I didn't know. She wanted to know how they treat kids with lead poisoning.
Yes, sir. So it depends on what their lead level is. If it's high enough, they may be hospitalized. For the most part, it's going to be parents making changes with diet, cleaning procedures, abating the home. So removing or cleaning the home, specialized to remove the lead that may be causing the poisoning. We just had a home that we did a risk assessment on this last week. I've been following a full case, confirmed case. And then we also have other cases that I have to wait for the confirmation. If the lead level is high enough, then I said go into the home, we have to do a lead risk assessment, find the problems. Depending on how big the problem is, depends on how big the fix is. At the actual lead level, the lead in the blood in the child is going to be lifestyle changes, home changes that the parents do, diet, and cleaning.
There's no particular treatment then for it, it just has to wear out.
essentially, if the lead level is on the lower side. If it's crazy high, that would be a hospitalization, that would be something called chelation, cleaning the blood, but we do that in extreme circumstances.
No, lead pipes in homes. I noticed, was it Bluffton, I think? They're replacing the lead pipes. Is that in the homes or is that the city facilities?
Decatur's actually currently doing that as well, and it's mostly leading. What the cities can do is remove the piping from the main line of the home. And so,
They're even being responsible all the way into the home on that.
yeah,
The good thing about it is you're not gonna get any lead ingestion from lead water lines because they'll be all sealed over, coated over. I've had some experience when I ran the water departments so that you don't need to worry about the water, drinking it. They are sealed, coated over. The city of Decatur, or all towns have to test for lead quarterly or twice a year. And they only make you test the homes that have lead in them, lead lines in them. So that's a plus that you know that the testing is being done on the proper scale.
I should be able to tell her something.
We have sticks too, like all of the lead risk assessments that I've ever went out and done over the last few years, the number one thing is to find the source of it. And we have sticks up at the health department that you can test paint and different things like that. If you think that it has, the lead based paint, a lot of times that's been the positive, and we've had, to scrape it all off and then repaint. One house that we went to a couple years ago, we found it was the makeup. The kid was playing on the shelf where the girls were doing their makeup, and that was very heavy in lead.
A lot of times the lead paint will peel.
cheap cosmetics from trying
Yeah.
to have lead in them.
Yep. So, just ultimately is finding that source and eliminating it.
Okay, thank you.
Technically, this would be the time of year where we could have voting for officers. So it's not on the agenda, but
Sorry.
that's all right. That's all
I
right.
made the agenda and I had no clue what I was doing, guys.
Since we have everything going on, I make a motion that we leave all officers as is so we can keep the flow going with this new, if that's all right with the prez.
Campaign's been tough.
5-year deal.
5 years. I don't think the term is 5 years though.
But I do believe that with all this work we got going on right now, trying to determine, are we gonna touch on maybe how we may change some things, or is that not at that time yet?
I don't think we're ready to talk about that yet.
All right. Well, there's,
Those of you who are officers now okay with that.
I told you I knew that this was probably coming, so I am okay with it. It's fine.
I think you're doing a stellar job. So.
Thank you. All right,
Probably need a vote to approve that.
yes. All right, so Barry had a motion, there was a second. All those in favor?
Aye.
All right, anything else business wise we need to discuss today? All right, motion to adjourn?
So moved.
All right, thank you all.
Story history and built still use copper.
Get stuck in.
I was hoping, but
On your name? Before I cleaned it up. We never even cleaned our lane. I normally don't. Unless it's just.